Estradiol spray, non-aerosol, is a hormone medication that is absorbed through the skin and enters into the bloodstream. It is used by women to help reduce hot flashes, which are a symptom of menopause caused by the body making less estrogen. If you are using estrogens to treat only vaginal symptoms of menopause, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. The recommended daily dosage and optimal timing for taking estradiol spray, non-aerosol, should be discussed with a healthcare professional. Before you start using this medication, make sure to read the patient information leaflet provided by your pharmacist. It's important to learn how to use the spray correctly, so if you have any questions, don't hesitate to ask your doctor or pharmacist. When using the spray for the first time, be sure to follow the instructions for priming it. Keep the spray upright and apply it to clean, dry skin on the inside area of your forearm, usually once daily in the morning as directed by your doctor. If your dose is for more than one spray, do not use more than one spray on the same area of the skin. Apply the spray next to each other but not overlapping, and avoid using it on broken or irritated skin. Do not apply it to other areas of the body, including the breast, face, or in or around the vagina. The dosage of this medication is based on your medical condition and response to treatment, so be sure to follow your doctor's instructions and do not increase your dose or use it more often than prescribed. After applying the medication, wash your hands thoroughly and wait at least 2 minutes for the application site to dry completely before dressing. Do not rub the medication into the skin, and cover the application site with clothing to prevent others from being exposed to the drug. If someone accidentally touches the application site, have them wash the area of contact on their body with soap and water. Also, keep pets from coming into contact with the application site. For the best effect, wait at least 1 hour before washing the application site to allow the drug to be absorbed through the skin. Use this medication regularly at the same time each day to get the most benefit from it. Be careful to avoid getting this medication in the eyes, and if it does get in the eyes, rinse them right away with warm water and tell your doctor if you experience any eye irritation. Remember that this medication is flammable until dry, so be sure to let it dry before smoking or going near an open flame. Keep track of the number of sprays you use, and discard the container after you have used the labeled number of sprays on the product package, even if there is medication left in the container. If your condition does not improve or worsens, be sure to inform your doctor. If you experience nausea/vomiting, bloating, breast tenderness, headache, or weight changes, make sure to talk to your doctor or pharmacist about it. It's important to remember that the benefit of using this medication outweighs the risk of side effects. However, if you experience any serious side effects such as nausea/vomiting that doesn't stop, mood changes, unusual vaginal bleeding, or severe stomach pain, seek medical help immediately. In rare cases, this medication may cause serious problems like blood clots, so watch out for symptoms like chest pain, sudden headache, trouble breathing, or swelling in the legs. If you notice any symptoms of a serious allergic reaction, such as rash or trouble breathing, seek medical help right away. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. Estrogens, whether used alone or with another hormone called progestin, can have some serious side effects. It's important to talk to your doctor about the risks and benefits of using hormone treatment. Estrogens should not be used to prevent heart disease or dementia. In postmenopausal women, estrogens, when taken with or without a progestin, can increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used along with a progestin, estrogens can also increase the risk of heart disease, such as heart attacks. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Talk to your doctor regularly to see if you still need to use it. If you will be taking this medication long-term, you should have regular complete physical exams as directed by your doctor. It's also important to keep this medication away from other people, especially children, as they may accidentally be exposed to it through contact with your skin where you sprayed it. If a child does come into contact with the medication and shows unexpected signs of puberty, such as an increase in breast or nipple size, it's important to tell the doctor right away. These side effects usually go away when exposure to this medication stops. Follow all directions for the proper use of this drug to decrease the risk of unwanted side effects. Before using estradiol spray, non-aerosol, it's important to talk to your doctor or pharmacist about any allergies you may have or if you have a history of certain medical conditions. This includes a history of blood clots, stroke, heart disease, liver or kidney disease, high blood pressure, diabetes, and certain hormone problems, among others. It's important to note that smoking while using this medication can increase your risk of stroke, blood clots, high blood pressure, and heart attack, especially in women over 35. If you have had or will be having surgery, or if you will be immobile for a long period of time, you may need to stop using this medication temporarily or take special precautions to reduce your risk of blood clots. Estradiol spray, non-aerosol, can also cause dark patches on the skin, which can be worsened by sunlight. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and wear protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may experience vision problems or difficulty wearing your contacts. This medication should not be used during pregnancy, and it may also affect the quality and amount of breast milk produced, so it's important to consult your doctor before breastfeeding while using estradiol spray, non-aerosol. It's important to be aware of potential drug interactions, as they can affect how your medications work and increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with estradiol spray, non-aerosol include aromatase inhibitors, such as anastrozole, exemestane, letrozole, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. It's also important to note that this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you use this drug. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms such as passing out or difficulty breathing, it is important to call 911 or a poison control center immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as unusual vaginal bleeding. It is important to be aware of these potential symptoms and seek immediate medical attention if they occur. It's important not to share this medication with others. While using this medication, it's essential to have regular physical exams and medical tests, such as blood pressure, breast exam/mammogram, pelvic exam, and pap smear. Follow your doctor's instructions on examining your breasts and report any lumps right away. It's important to keep all medical and lab appointments. Consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes that can help include reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking. Keeping your mind active with mental exercises, like reading and solving crossword puzzles, can also help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. There are also lifestyle changes that may help reduce hot flashes, such as stopping smoking, dressing lightly or in layers, avoiding/limiting certain foods, spicy foods, caffeine, alcohol, reducing stress, and exercising regularly. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, within 12 hours, skip the missed dose and take your next dose at the regular time. Do not take double the dose to make up for the missed one. When it comes to storing estradiol spray, non-aerosol, it's important to keep it at room temperature and away from heat. It should also be kept away from open flames, and out of reach of children and pets. When it comes to disposing of the product, it's essential not to flush it down the toilet or pour it into a drain unless instructed. Instead, it should be properly discarded when expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.